And today, Dr. Kendall Reed is with us, and I always have a tough time saying this, gastroenterology.
Close enough.
But basically, we're talking about having colonoscopies and colon cancer.
Well, this is kind of a special month that we want people to be aware of.
It really is. March has been noted as Colon Cancer Awareness Month, and we wanted to kind of bring some information about colorectal cancer screening and how important it is to this country. Colon cancer is our fourth leading cancer in this country from the standpoint of numbers diagnosed, and so it's a real significant problem for the United States.
But one of those, if it's caught early enough, is treatable, and we can keep it from taking over, right?
Absolutely. Colon cancer is one of those diseases not only that we can catch early, but we can prevent. It's one of the few cancers that we can prevent. And the reason that we can do that is because all colon cancers, at least that we think today, start from benign polyps. And so if we get people in for routine screening when they should be, then we can take those polyps out before they become cancer. And so in the United States last year, there were approximately 132,000 colorectal cancer cases diagnosed. The good news is, though, that over the last 10 years, the number of cases has actually gone down. If you look at the population per 100,000. And the reason it's going down is because people are doing colonoscopic screening.
I was going to say, so the biggest thing is prevention. So we want to make sure people are doing what they're supposed to do, and the big thing is?
The big thing is colonoscopy.
Okay.
And you need to stay in touch with your primary care provider and get into a system that can provide that colonoscopic screening. So there's a lot of people are afraid of colonoscopy because just the thought of it doesn't sound too appealing, but in actuality, it goes pretty well. And we're able to do that with a small prep a few days before, come in, get the colonoscopic screening, and you're out within 2 to 3 hours after the procedure.
Now, you're an expert at Broadlawns, but when should you start this? I mean, should you do it every year when you start at 18, 10?
No, there's some very specific guidelines that have been developed over the last 20 years or so that really colonoscopic screening for the average normal risk person, that is somebody that doesn't have a family history, doesn't have any other conditions that are inherited that may predispose them to cancer, they should start screening at age 50. If you are at high risk and have something like ulcerative colitis or Crohn's disease or an inflammatory bowel disease or a family history, and particularly a first-degree relative such as a brother, sister, mother, father, you should start screening probably at age 40. Once you've had your initial screening, then depending upon what is found at that screening, then we make recommendations as to when you get that next screening. For the normal risk person that has a normal colonoscopy, no polyps taken out, then the next screening would be 10 years.
Are there any other signs that you should look for if you're at other ages or that'd be abnormal?
Yeah, you know, over the years, we've all been told about the warning signs of colon cancer. And the problem, though, that we find is if you wait until you have symptoms, the chances of cure go dramatically down, and the symptoms of rectal bleeding, abdominal pain, change in your stool habits, those things, if you're actually having those symptoms, that's not a good sign. And so we want to see patients before they have symptoms. It's clearly been shown that the earlier that you find colon cancer, the better your survival. And obviously, if we can find benign polyps that aren't cancer, then your chance of cure is extremely high.
And Jason, you've been over at Broadlawns. Just incredible things are happening over in that space, and we want people to know that there is an option over there if you're looking for a place to get a colonoscopy, because it's Awareness Month, folks. We want to bring awareness so that you know to go in, because prevention is the key in a circumstance like this.
You bet.
Wonderful facility. It's been upgraded to a great degree in a very short amount of time. And what struck me the most about Broadlawns was the people there are happy to be there. There just seems to be a great camaraderie and great morale at Broadlawns.
Yeah, it's a great organization. I've been in Des Moines for approximately 30 years. I'm a surgical oncologist by that's what I practiced for the last 30 years as a cancer surgeon, and my focus now has been in gastroenterology, and particularly colorectal cancer screening, because it's something that we certainly have the potential to really make an impact on.
Right. If we can prevent it from happening just by having, I don't know if I'm going to say a simple procedure, but maybe it is on our end, not so much your end.
It's something we do every day, and it goes very smoothly.
Okay.
Yeah.
So make sure you make that appointment, get that done, especially if you're 50 years old, unless you have something else in your life history.
Those risk factors that we talked about, yeah. And we know that there's certainly certain things that put you at risk. Age is one of them, actually. The older you are, the more likely you are to develop a colon cancer. Certain lifestyle things, obesity, alcohol, they all play into the development of colon cancer. So that's the reason it's important for you to talk to your primary care physician, look at your individual risk factors for you, and they can determine when the best time to start that screening.
Wonderful.
Dr. Reed, great things happening at Broadlawns.
Thank you very much.
Appreciate
Glad
it.
to be here. Thank you.
All right, there's the information, and give them a call if you want any more information or to schedule a screening for yourself. Remember, it is Colon Cancer Awareness Month.